Before this call, we were talking a little bit about outcome-based care, or in our industry, we kind of call it value-based care.
Mhm.
And you work with Medicare waiver programs as well. And we're seeing that, private duty isn't very regulated, but some of these, I call them sister industries or other sectors of home health, are very regulated. And we're moving towards value-based care, proving these outcomes so that we can kind of prove our worth to the whole healthcare continuum. And this technology, like you said, can measure fall prevention. And that is one of
Sure.
the key outcomes for a lot of home care providers is to reduce hospital readmission rates and to reduce falls. So anything you want to add there on using technology to prove that your agency or our industry is helping reduce those outcomes?
No, that's a great point. That shift is huge. We know that that shift is happening, and we're frequently getting more and more requests for data around button presses and falls and things like that. And that's where I think the the tying in of the smart home is going to become extremely important. And as I mentioned before, our partnership with Google is very exciting because Google owns Fitbit now. And what can we potentially do down the road with a Google, a Fitbit, and the smart home plus we're calling it smart aging, and what can we do to provide a lot of insights and data back that help guide those Medicare programs in terms of like where are the risks, how do we avoid those risks, how do we avoid readmissions, and something as simple as starting to gather that data from an activity perspective. How active is someone in the home, and what insights can I use around AI or machine learning to say, okay, this person moved around, and it's almost hard to describe because my mind can't comprehend all the like if this then that. But when you start to combine them all, like this person's activity level was X, and over the course of time I can see it starting to dwindle. So what's going on there? Or even something so simple as saying, you know bathroom usage. Okay, you know this customer goes into the bathroom on average 5 times a day, and then suddenly they're going into the bathroom 10 times a day. Like there's something wrong there. Is there something happening to their health that we need to intervene ahead of? They may not even notice the difference. So being able to gather that information, and we're kind of uniquely positioned because we have so many of these smart home devices and sensors already deployed out in the world today to really capitalize on that. And what can we do with that data to help those agencies save costs, avoid, improve the outcomes is really what the goal is, and say, can I intervene ahead of time before someone, and that gets into remote patient management and things like that. Can I make those devices easy to use? Can I provide non-intrusive or non-annoying reminders to say, hey, you need to do this, you need to do that. It can be something as simple on, say, your Fitbit that reminds you to, hey, get up and take a few steps, or you've been sitting a little longer than normal. Is everything okay? And provide that insight or that information on to a home care provider or a caregiver to say, hey, you might want to check in on mom, make sure everything's okay.
It's so exciting. I'm one of the younger people in this industry to speak to some of these topics, but I think it's really exciting. We're headed in a really good direction with a lot of opportunities, and with so many seniors turning 60, 65 every single day, we've got to come up with solutions that integrate technology with the one-to-one personalized care. This industry is so human to human, and I think providers are going to have somewhat of a hard time adopting this, but it's really the only way forward.